before that, let me introduce myself. My name is Kailish. I'm actually the research assistant, actually, no longer intern. I'm research assistant for Angsana Health. And I'm very happy to introduce our speaker. So before the speaker actually kind of start, let me kind of introduce what she does. But she's quite impressive because when I went to her biography, it was I was just very fascinated by the things she has done. So Dr. Shu Hui is the medical director of Angsana Health. She's responsible for clinical protocol development and operations of all health business units, building a digital primary healthcare system in Malaysia and Southeast Asia, and delivering a human-centered, value-based, and integrated primary healthcare. She received her MBBS from Monash University in Malaysia and did an MRCP from Royal College of Physicians, and she did an LL.M in medical law and ethics from University of Edinburgh, and experience in public hospitals, refugee clinics, and with Doctors Without Borders. So you can trust her that she's the most ethical person onto knowing how to actually operate in a clinical setting. She has vast experience as a medical officer in Department of Internal Medicine in Hospital Sultan Ismail and District Hospital in Al Gajah. Her research focus also includes migration health ethics in Southeast Asia, healthcare access for vulnerable population, and ethical challenges in clinical practice during COVID-19. So without any further ado, Dr. Shu Hui.
Thank you, Kailash, for the kind introduction. Good afternoon, everyone. Thank you very much for spending your afternoon with us today. My name is Shu Hui. Like what Kailash mentioned, I'm a medical doctor and also medical director for Angsana Health. So I'm going to share my screen now. And if during my presentation, if you are unable to hear me or unable to see, please just voice it out because I might not be able to see the participant screen when I'm looking at the slides. Yeah, so Kailash might need your help for that. Yeah, okay, so share my screen. Okay, all right. So welcome to today's discussion about virtual health services. So my goal today is to help seniors understand what virtual health services are, some of the benefits that they offer, and how you as a senior or a caretaker or even a healthcare provider in the community setting can take advantage of virtual health services. During today's discussion, we will also address some of the common concerns that seniors or even healthcare providers might have. And I will share some experiences from other seniors who have successfully used some of these virtual health services. So before we go into virtual health services, I'll provide a very brief introduction to Angsana Health. So Angsana Health is actually founded in 2022 in Malaysia, and we offer virtual health services focusing on autism and also liver health. For seniors specifically, Angsana Health has actually digitized various health screenings developed by Act for Health, and these include screenings for dementia, and fall risk, and also home hazard assessment. So there are also virtual brain exercises and tele-rehabilitation program known as Otago Exercise. It is an online exercise program. And if you would like to know more about each of these services, you can scan the QR on display now. I just checked. It worked. Yeah, so hopefully you'll be able to scan it as well for more information. Okay. Right. So we heard about virtual health services quite often, especially in the last few years. So virtual health services actually covers a range of healthcare options delivered through online platforms. Sometimes you may hear people saying that it is online consultation, or even like telehealth or teleconsultation. So these terms are usually used quite interchangeably. So these can include online consultation. This is when seniors or anyone will meet their doctor or specialist via a video call. So you can receive medical advice, diagnosis, and treatment through online communication with your doctor. So it's quite similar to what we're doing now, but of course there will not be so many other attendees. And online consultation is frequently used for mental health support, physiotherapy, and management of chronic diseases, long-term diseases like diabetes and high blood pressure. So in general, it is not normally used for emergency, but for follow-up care and also consultation for nutrition or physiotherapists. So these virtual health services are not only used by doctors or nurses, but it can also be other healthcare professionals. For example, like I mentioned just now, physiotherapists, nutritionists, they can also deliver their consultation services online. Secondly is remote monitoring, whereby you might be given a device or you use your own phone to track some of your health data, and that can be shared with your healthcare provider. So some very common examples would be blood pressure, blood sugar level, or even your heart rate monitoring, and that can be communicated with your healthcare provider. And sometimes health screening can also be conducted virtually. For example, screening for the risk of dementia or the risk of fall. So all these can be done online, and they are examples of virtual health services. So why virtual health services? So Malaysia, like many other countries, is experiencing a demographic shift towards an aging population. So as of 2024 this year, we have an elderly population. By elderly, we mean people aged 65 and above, comprising about 8% of our total population. So with our total population of about 34 million people, that's about 2.7 million elderly individuals. So this transition actually brings about an increase in age-related health issues, chronic diseases, long-term diseases to be managed, and a higher demand for continuous medical care. So virtual health services provide a solution to address some parts of these growing needs. And traditional healthcare has predominantly relied on the brick and mortar model, where patients must visit physical clinic and hospitals for consultation, treatments, and purchases of medication. But this approach can be limiting, particularly in rural areas or for patients or seniors with issues with mobility or even accessing any healthcare facility. So children usually have to take time off from work to bring their parents or family members to physical clinics. So virtual health services can be a useful way, and it sort of became a necessity and an opportunity when we had the COVID-19 pandemic, when our mobility was restricted, and when we had to rely on our phones and internet for almost everything. And that's when we know that virtual health services can sometimes be very useful. And increased use of digital apps in various sectors, like transportation. I think most of us are very familiar with using Grab or even Shopee for buying things, food delivery, etc. So it has significantly influenced our consumer behavior, whereby we used to have to go to somewhere physical to get what we need. But nowadays, people are increasingly accustomed to the convenience and efficiency of using digital apps for their daily needs. So this trend has naturally bled into our healthcare space as well. So virtual health services use the same technology. Some of the providers, they offer user-friendly apps for booking appointments, consulting with doctors, or even receiving medication prescriptions. So, like I mentioned a little bit just now, there are quite a number of benefits of using virtual health services. So the most obvious and the first benefit is, of course, the accessibility, because seniors can access healthcare without needing to leave their home. And this is especially beneficial for seniors who are not able to mobilize as freely, or for those who live in remote areas or where there are areas where there are limited specialists to consult. So virtual platforms also allows seniors to consult with specialists who may not be available locally. So it also broadens their options for expert care. And secondly is, of course, the convenience. Because it is more accessible, you can do it anytime at home. It saves time in traveling to a healthcare facility. And I think all of us who have been to any healthcare facility would know that finding parking and then just getting around, navigating the healthcare facility is very time consuming. And for seniors who require children or their caretakers, this would allow the caretakers to not having to take a full day off at least. And it also reduces exposure to health risks from healthcare facilities and avoid very long waiting times at different healthcare facilities. So in certain ways, virtual health services allows for improved care because it is easier to maintain regular contact with your healthcare providers if they do provide such an option, and you can manage your health conditions more effectively. So for virtual health screening, this happens when you don't actually have a diagnosed disease yet, but screening is just to find out whether you have any signs or symptoms of having any kind of healthcare problems. So this allows earlier detection of diseases, and it allows for earlier management if at all any problem is identified during any of the healthcare screening. So some of the screening tests can be done virtually online. So yeah. Okay, so with advantages, there's also disadvantages as well. So one significant drawback of virtual health services is that doctors are not able to, or any healthcare providers, they are not able to perform a physical examination or like a physical assessment. Yeah. So while a lot of aspect of consultation, for example, like when we need to do history taking, I need to take a history, that can be done quite easily remotely, but procedures and physical examinations still would require in-person visit. So this limitation can sometimes affect the accuracy of diagnosis and the effectiveness of any treatment plan. So usually if you have a virtual consultation with your healthcare provider, and if at all the healthcare provider thinks that physical examination is necessary, so they would usually request for an in-person visit, whether it's with them or with somebody who is nearer to where you are at. So medical procedures and treatment also cannot be conducted virtually. So for example, small surgeries has to be done in a clinic or in a hospitals, very detailed physical examination, and some of the diagnostic testing, you still require in-person visit. So this would actually mean that virtual health services, although useful, it cannot completely replace traditional healthcare services. And another point to note is that not all insurance providers cover virtual health services, and the reimbursement rates may differ from those for in-person visit. So this can actually limit the availability and usefulness of virtual health services for both healthcare providers and also patients. So it is always good to check with your insurance provider whether virtual health services is actually part of your insurance coverage or not. Yeah, so by now, I think some of you, if you have not undergone or used any virtual health services, I'm going to show a quick video next to show you, like, give you an idea what virtual health service would look like. And then at the end of today's discussion, we'll have a quick demo. Yeah, so, okay.
The 5-point assessment will take roughly 30 to 40 minutes. During the session, you will answer a set of questions and complete some cognitive tasks. The doctor will then guide you through some simple movements and exercises with either the weights you prepared or the furniture near you. Once the assessment is complete, the system will email your results to you and provide recommendations and next steps.
Kailash, just wondering if just now you are able to hear and see the video?
Yes, it was
Okay.
well.
Okay, just in case I'm the only one hearing it. Okay, all right. Okay, so so that shows how a virtual health consultation can look like, whereby your healthcare provider is on the other end, and then you might be asked a few questions or do certain actions, and just answering a few questions for the healthcare provider to assess. Yeah. So although virtual health services, they do offer like all the benefits that I've mentioned just now, they do come with their own set of challenges, especially for our senior community. So we will now go through some of these challenges together, and we will explore like if you were going to engage with virtual health services, what are some of the potential solutions that you can do? So firstly, one of the most significant challenges is to adapt to new technology. I see that many of you are here, and it is no issue with using this Google Meet, but some of us don't really use internet normally, although it is becoming like less and less. Most people now use internet. So, but some people did not grow up with using internet, smartphones, tablets, or laptops. And sometimes learning how to use these devices can be quite overwhelming. And occasionally, like telehealth platforms, some healthcare providers, they would use a specific service provider. It can be something like a Remedy, which is an online clinic, Doxy, or even like Zoom. Some of the healthcare providers would use Zoom as well. And it can all seem very complicated at first. And whether it is scheduling an appointment or attending a virtual consultation, so every step can potentially be a challenge. I'll talk about internet later. So it is very helpful to have written instruction and also practice using these tools when it is in a low stress environment. So most healthcare providers, they will offer support services to help patients, especially seniors, navigate these platforms, so that before the actual consultation, you will have the opportunity to utilize it first, to get used to it. Yeah, but it is true that sometimes using digital tools for to access health can be a tricky endeavor. So another problem that we commonly encounter is actually issue with internet connectivity. So even though we try our best to say like use Wi-Fi and try not to use unstable kind of internet connection, for example 3G or 4G, but sometimes it's just inevitable, and because there will always be unexpected circumstances, like suddenly there's no electricity, or suddenly the internet is not functioning, and that can sometimes disrupt the virtual health service that you try to engage with. So it is a good idea to always ensure that internet service is quite reliable, and always have a backup plan. And we always tell seniors or anyone who engage our service to, we always teach them like how to swap from Wi-Fi to like 4G or 5G, for example, a hotspot, or having somebody to help will be very useful in case of connectivity issues. And also choosing the right spot in the house with the strongest Wi-Fi signal can actually make a very big difference, so that during the virtual consultation, you will not be trying to find like where can you get the best internet connectivity. So that would actually save a lot of time and avoid stress. And then thirdly, is that some seniors might face issues with hearing or seeing or even understanding healthcare providers. So before you engage with the service, always make sure that, of course, language should be one that you understand, and also making sure that the device audio and visual setting are optimized to your needs. Sometimes it's good to use headphones because it eliminates the ambient noise, or you adjust the screen brightness or the text size. Sometimes If you have problems with hearing or also or any visual problem, I think it's good practice to tell the healthcare provider first so that we can make adjustments so that it's better during the consultation. So if you find understanding medical information challenging during the virtual health service, don't hesitate to ask your healthcare provider to explain it again in a different manner, a clearer manner, or ask for provision of written instructions after the virtual health service, or during is possible as well. So lastly, we have also encountered some concerns about the security of internet links and also sharing of personal health information. So we receive so many scams or text messages just randomly asking us to click on this link or that link. And occasionally when the link is sent to our patients or our seniors, people will be quite hesitant to just directly click on it because we don't know whether this is a scam and will it like later take all my money from my bank. So it is very important for the healthcare provider to use secure and reputable platforms for virtual health services. And if at all, as a patient or as a senior, you are doubtful whether this is the actual link being sent by your healthcare provider, I think it is always very good. It's a good practice to ask the healthcare provider, is this the link that you sent to me through email or WhatsApp? To make sure that all these unwanted things like it will not happen. And it's also important to make sure that like the laptop or ask the children to make sure that the laptop is quite updated to the latest security software, and be very cautious about sharing personal information online. If in doubt, I think the best way forward is really to ask the healthcare provider what is the actual link, and then is it all safe for you to click and to engage with the services. Okay, so I hope that's quite clear. So these are the 4 most common challenges that we have encountered. So I thought it would be good for us to go through. And if there are problems, usually there are some ways and some solutions. So we'll now discuss some of the practical ways to mitigate some of the potential difficulties that you might face when using any digital tool or telehealth platforms. So you can join training sessions or tutorials to get comfortable with all these digital tools, like where to click and how do you navigate to this page or that page. So this can be like all this practice can be quite effective in teaching you how to use different kinds of platform, because it's different for Google Meet, for example, and it's different for Zoom. And there are also video guides available online that provide step-by-step instruction. Or as healthcare providers, we would also provide step-by-step guide so that you know what to do, like what are the steps to follow to access the consultation or the virtual health services. And there will usually be a helpline or chat support that many telehealth platforms would offer. So you should always keep a mobile phone nearby. If you're using, if you're not using your mobile phone, you're using a tablet or a laptop, keeping it nearby so whenever you need to call for help, it is easier. Yeah, and yeah, I see that there's a comment saying that prefer Zoom over Google Meet. There are pros and cons to each of them, and it really depends on the virtual health service, your healthcare provider, which one is the platform that they engage with, and it can be different for different virtual health services. So like chat support or helpline, sometimes they can just provide you with immediate assistance, maybe like changing a new link for you, or if you have any technical difficulties or need help in navigating the platform. And very helpful, and these are the things that actually help a lot, is to ask for help sometimes. So sometimes you just need somebody to show you in real life, like, to tell you like how to navigate these platforms. So don't hesitate to ask for help from caregivers, family members, or even your friend, so they can help you set it up. And then if at all they are around when the virtual health service is going on, they can help you with troubleshooting the issues, or they can help you with like other problems. Sometimes like the audio has got problem and you need to troubleshoot that. And once you have seen how people do it, then perhaps the next time you will also be able to do it on your own. Yeah. And like I've mentioned just now, it is very helpful to test your devices and internet connection before your scheduled consultation time. So this will ensure that everything is working properly, and it reduces the chances of last minute issues. But sometimes, like even when you have done all that, something still go wrong. So if something does go wrong, you can have a backup plan. For example, letting your healthcare provider know. And sometimes occasionally we can just swap with using just a phone call instead. So this can ensure that you still receive the care and the service that you need. Otherwise, you can always contact the healthcare provider. If all fails, you can always reschedule for another time and discuss with your healthcare provider. So if there's any limitations that you might have, let them know first, whether it is hearing difficulties, eye issues, vision issue, trouble understanding spoken instructions. So by informing them ahead of time will allow them to make necessary adjustment for you. For example, they might make the font bigger, use visual aids, or they can speak slower, more clearly, adjusting the volume. And sometimes it's also possible to convert speech to text, and you can actually see the text while the healthcare provider is speaking with you. So when using telehealth platforms, most of the healthcare providers in our country actually comply with all regulation to protect your privacy, and all of them usually have got very high security levels. It's mostly encrypted. But at the same time, as a patient or even like a healthcare provider, you should always use a personal and private space when sharing personal information, because that would ensure that your information remains confidential. So this is something that both the healthcare provider and also the patient or the recipient of the healthcare service must be diligent in maintaining privacy and confidentiality. Okay, right. So these are I think these are some of the ways that we have tried, and we think that that is usually quite helpful in mitigating some of the concerns and challenges seniors might have when they engage with our virtual health services. So I will now share with you a pilot program of virtual health screening for seniors by Angsana Health a few months ago. So earlier this year, we conducted a virtual 5-point screening, which is a screening tool validated in the Malaysian population by Act for Health, and it assesses cognition, low blood pressure symptoms, muscle strength, gait, balance, and also body mass index. So it was facilitated by a local non-governmental organization, NGO. So the process was guided by volunteers, and the assessment were conducted using a virtual telehealth platform. So each of our screening session actually lasted between 30 to 45 minutes. And during that period of time, like 30 to 45 minutes, the assessors evaluated these 5 critical senior health parameters. And for this pilot program, some of the volunteers were with the seniors to assist them with any technical issues that happen during the virtual consultation. But fortunately, during that time, we did not encounter too much of technical issues. Yeah, so it was quite a smooth pilot program. So following the assessment, these participants, they actually receive personalized guidance on managing any identified health issues, because this is a screening. So we were trying to see if the seniors have got any health issue. So this included giving practical advice and strategies tailored to their specific needs. So based on the findings of the health screening, we can then give them advice and also strategies on how do they sort of solve some of the problems that we found that they might have. So if medical assessment or medical assessment in person or any kind of intervention was found to be necessary, the participants were referred to geriatricians or to tertiary centers so that they can receive the level of care that they should receive through the screening. So after the screening, we actually did a survey to ask how the participants feel. All the participants were above 65 years old, and all of them actually reported increased overall confidence in making some lifestyle changes after the screening. They felt more confident in managing their memory problems that they might have, and also some symptoms of dizziness, like when they try to sit up or stand up from a sitting position, orthostatic hypotension. And some of the seniors were very happy because they were able to ask questions that they have about memory, and some felt quite relieved to know that there's actually nothing wrong through the health screening. So with we also assess their strength, gait, and balance, and all of them has got reported more confidence in managing and also in their mobility inside the house or outside the house. And for weight management, because we do ask them about their weight and also their height, so that we know whether they fall into underweight, overweight, or obese category, and we do give them some of nutritional assessment and also consultation, like very brief ones. So overall, everybody was very satisfied with the services. And one of our participants received a referral for further cognitive like brain assessment and also training. And some of them actually told us that they had some concerns about their level of digital literacy, but with some amount of assistance from others, all of them were actually able to engage with the virtual health services. And 3 of the participants actually think that this kind of virtual health screening activities would benefit them, because they can just do it at home and they don't have to travel to any healthcare facility. And all of them were happy to have their health concerns answered by our assessors online. Yeah, so what we found from our like a pilot program was that virtual health services has the potential in promoting proactive senior healthcare. Many of them were quite comfortable in using digital health services, just a little bit of practice, some guidance. And in fact, some of them were able to do it independently without much help from the volunteers. But everyone was able to eventually do it after a few tries. And because we also provide virtual brain services for seniors. And one of the seniors actually told us that he was happy to not just be able to use the health services, but also becoming more confident in navigating all these online platforms with a few tries and practice. And even her children were very impressed by her. Yeah, so it is possible. And it is not that difficult with guidance, and also bearing in mind that there are some challenges, but there are also some solutions for us to sort of mitigate the challenges that we can potentially face during when we engage virtual health service. Yeah, so I'm going to stop here for my presentation. And Kailash and I would like to show a short live demo of the 5-point screening, which I mentioned just now. And this aims to assess memory, balance, strength, blood pressure, and also body mass index. So this is a sort of like a preventive screening, and it is recommended to be done on a yearly basis at least. Kailash, are you okay?
Yeah, I'm okay. But just for the participants here, I'm not as handsome as the uncle in the video. So you guys have to keep it up with it, yeah? Okay. I'm
Yeah.
ready.
Yeah, thank you so much, Kailash, for volunteering. So we will do just some part of the 5-point screening. We're not going to go through the whole thing. So just to give you an idea about how a virtual health service would look like. So it is actually very similar to what we are doing now. And like I mentioned earlier, it's like there will just be you and the healthcare provider. So it should be just me and Kailash with no other no other audience. And of course, sometimes you can ask your caregiver, children, or whoever who is relevant to your care and to be around. So this is a screening test, and I will check Kailash's memory. Okay.
Okay.
So we'll start. So hi Kailash, my name is Dr. Ng, and today we are going to assess your memory. And Kailash, you are able to see my screen, right?
Yes.
Okay, all right. So Kailash, I would like you to identify the pictures shown on the screen one by one.
It's a bicycle, feet,
Mhm.
wrist or bangle. I don't know what should I point out here, and a monkey.
Okay, so Bengal is fine. It's great. Yeah. So can you tell me? So you have named each of these item, and can I now ask you to categorize them? So a bicycle is a,
Form of transportation.
yep, and then the next one.
Feet is a part of body, a body part.
Uh-huh.
Bangle is an accessory.
Okay.
A monkey is an animal.
Okay. Excellent. So now you have now identified all the 4 pictures. Please try and remember them. And I'm going to stop sharing my screen. Okay, so Kailash, can I get you to count from 1 to 20?
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Okay, so now a little bit more challenging for you. Can you count 20 backwards to 1?
Okay, 20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Okay. Wow, thank you, Joy.
You are correct. It was very fast. Yeah. So, okay. Thank you very much, Kailash. So now, can you try and recall the 4 items that you saw just now?
It was a bicycle,
Mm-hmm.
a bangle, and a monkey.
Mm-hmm. Is there anything else?
Wait, it was a bicycle, feet, like 2 feet, bangle, and monkey. Yes.
Okay, yeah. So that's 4. Okay, excellent. Okay. So yeah. So Kailash, just wanted to let you know that you do not have a memory problem. So what will happen during what will happen during this kind of screening is that the assessor will score the participant, and then based on the scoring found through the assessment, we will then identify whether somebody has got a normal kind of no problems with the memory, or if there's any possibility of dementia or any more concerning problems.
Um,
And sorry.
So if I'm forgetting stuff during my exam, that's normal, right?
We will have to assess you your reason why you are forgetting things during exam. Yeah,
I
but
just didn't study. That's it. But it's okay. Please continue.
yeah, so for this assessment, if at all it's been found that there is a possibility of dementia, then the healthcare provider, the assessor, will then be able to direct you to receiving appropriate health intervention. And this can be done not just for memory, it can also be done for false risks. It can also be done to see whether what about your muscle strength, and what about your any problems with blood pressure, because there are lots of people who are taking a lot of different kinds of medications, and sometimes that can affect the blood pressure. And it can also just be because it's part of aging that blood pressure can have some problems. So that actually concludes the presentation. And now we'll open the floor to any questions from anybody. You please feel free to, I think you can just raise hand, and also just verbalize it, or you can also type the questions that you have on the chat, and then we can answer them. Any questions? I think there will be an e-certificate given by Act for Health. Yep. And I think Zoom over Google Meet. Any doubts or anything that you would like to know about virtual health services, please feel free to ask. Yeah.
So there is a question.
Mm.
This is directed to obviously Dr. Shu Hui. The Ministry of Health keen to promote virtual screening.
Okay, so I don't have a direct yes or no answer to this, but virtual screening, it is one of the ways to make screening more accessible, because with our manpower in our healthcare sphere at the moment, it is quite difficult for people to engage with in-person services, because then you will need to think about transportation and things like that. But as long as somebody has got internet connection and also an electronic device, then it can be easily done. I would hope that the Ministry of Health would be keen to promote virtual screening, because then we would be able to help people who are in rural areas. As long as they have got some kind of internet connection, then that would be very helpful for us to pick up health problems as early as possible. Yeah, thank you.
All right, thank you for the question, Ms. Maven. You also have another question. Is virtual screening consultation generally cheaper?
I think it can be cheaper if you consider like everything, like all-inclusive costs, because for the service itself, because we would still be paying the healthcare provider what they're usually being paid. So for example, for nutritionists, there is a specific amount of market range that they're being paid. So usually the engagement with the consultant, whether the consultant is a doctor or a nutritionist or physiotherapist, that would still be the same amount. But generally, it should be cheaper, because you will also be omitting costs of having to travel there, having to wait, and having to take time off. So I would say that in general, virtual screening would be cheaper than an in-person. But of course, it really depends on if it's just screening, then I think it would be definitely beneficial if you can do it virtually. But in person is also possible if people would prefer in person.
Sorry, Dr. Shu Hui, can I also make a case for virtual screening? Is that one, you don't have to travel through your Grab, or you don't have to pay your tolls, and also you don't have to pay for your parking, and also, you don't have to wait for a 6 months appointment like in a UMMC where you have to go there because of the list. The waiting list is too long. So yeah, that's generally the case for virtual screening. So Hu Jin Ong has a question. What is your current coverage areas for virtual screening?
I think this coverage area, sorry, Hui Jin, I was just okay, I'll just answer for both. Like coverage area, if you mean geographical, then it does not really matter, as long as somebody has got internet connection and also electronic device. Phone is okay, but usually we prefer something with a bigger screen. So an iPad is good. Any tablet, doesn't have to be Apple, or like a desktop or a laptop, then it will be very good. So there is no geographical limitation to virtual screening. And for coverage area, if you're talking about which area do we cover? For seniors, we have fall risk assessment. We have screening for memory impairment. And we also have the service for home hazard assessment to check whether the house is safe to be for seniors to be at home. And we actually have others as well for autism. So that's one of our coverage area, but it's not relevant to seniors. That's for children. Yeah. So that's the answer for Hui Jin. Yeah, I hope that answers the question.
Hu Jin, you might text whether it answers your question, or if you want to rephrase your question in another way, please go ahead. From Zizi Diong, how do you train the health provider for the virtual screening?
Okay. Right. So Act for Health actually have a very comprehensive training that all healthcare providers who wish to partake in virtual screening have to undergo before they do it. So the assessor, when they are being trained, they will be trained about some of the things that I've mentioned just now during the presentation, and also how do they conduct the virtual screening effectively online. So there are training modules that an assessor would have to undergo the training, and because telehealth, like virtual consultation and all that, is also a growing field. So there are, although we don't really have specific laws and regulation governing telemedicine itself, but we will also, like for doctors, for example, we also have guidelines that we need to follow set by the Malaysian Medical Council. So that would be helpful in making sure that we always uphold your privacy and confidentiality, and also making sure that the virtual screening is effective and also reliable for anybody who engage with the service. Yeah. So there are training. We have to undergo training, and that's done by very well done by Act for Health. Yeah.
So in terms of Act for Health, Dr. Nina is actually the one who's usually does this training assessment, and she did her PhD actually in cognitive assessment. So please be ensured that in terms of Act for Health, we have one of the most competent person who's handling this. Yes, Dr. Nina. Okay.
It's true. So because I think you will need some experience, and also undergoing the training gives the assessor because not everyone is readily familiar with this new kind of platform and also services. So with training, it really helps both the provider and also the patient. Yeah.
As one of the questions, this is our second last question. So again from Hujin, if an elderly is required to have physical examination after the virtual screening, do you provide recommendation for particular physician/specialist?
Okay. So usually if somebody requires physical examination or even further assessment that is supposed to be done in person, we would provide recommendations, but not to a particular physician or specialist. Act for Health actually have got a very comprehensive private and also public healthcare facilities that patients can go to. So it really depends on geographical region where you are at. If you're somebody from Ipoh, then perhaps it will not be wise for you to go all the way to Kuala Lumpur, for example, for to see a geriatrician, because there are geriatrician in Ipoh. So we would provide some recommendations, but it also really depends on the urgency of the problem, how soon you need to go, whether it is an outpatient or is it an emergency, and then it should be to the physician or specialist nearest to you, most convenient to you. So we don't generally give like a specific name, but it is on a case by case basis. But we do have a general guide on where to go to. Yep.
All right, thank you so much for the answer. And for one of the last questions, how many virtual screening providers are there in Malaysia so far?
Oh no, this is like, I don't know how many are there though. I don't know the exact number, but for the validated health screening for seniors, Angsana Health actually partners with Act for Health. So that's the one that I know. Maybe like perhaps Dr. Nina would know, but I think for virtual senior health screening, I think for now it should be just Angsana Health, but there might be out there other in the market that I'm not aware of. I'm sorry, I don't have the exact number, but for virtual health screening for seniors, I think Act for Health is one of the ones who the health screening is validated by Act for Health, and Angsana Health digitize them so that we provide the service virtually as well, so that it hopefully can reach more people. Yeah.
So yes, all right. For a final call, is there any other question from the participants?
Got any online certificate?
Yes,
certificate.
for the certificate, yes, but you do have to fill out a feedback form, which I will email to you later this. So no worries. So
Okay.
after you fill out the feedback, You will receive your e-certificate within 2 to 3 working days. And thank you for reminding me. I should have been saying it actually at the before this webinar, but it's okay. Now that everyone knows that we can actually continue from it. So assuming there is no other question, so we can also share the feedback links here. We will email to you, no worries, because we just want to make sure it is safe for people to kind of like access it. So Act for Health. So if you ever want to know an introduction to Act for Health and what we do, on the left we have a QR code on our services, and on the right we have the Senior Health e-booklet, which is the World Health Organization's recommended Senior Health to Go, which is twice a year. So in this Senior Health e-booklet, we have for 5 years actually. So if you have any form of questions or whatever, you can call it Act for Health. So with that, also our upcoming event, this is something important because I know a lot of senior citizens are here. We are doing a free webinar on Confident Care, a guide to bedside prevention and management in older adults. We understand there are a lot of caregivers here who are taking care of elderly people and people who are kind of immobile or bedridden. So this is a chance for us to actually understand how to do. And 3 speakers are here. One is Associate Professor Dr. Kor Hui Min. She's the Consultant Geriatrician of UMMC. And we also have Dr. Lee Wan Ling. She's a Senior Lecturer of Department of Nursing Science